Lesson 8. Applying acupressure to treat trigeminal neuralgia. Trigeminal neuralgia is characterized by intense pain attacks lasting from a few seconds to a few minutes without following any specific pattern. The causes of trigeminal neuralgia include blood vessel compression, tumor compression, or viral infection. Before performing acupressure, we need to disinfect and warm up our hands. The following 17 acupoints will help you improve and support the treatment of trigeminal neuralgia right at home. The first is the Yang Bai acupoint. The Yang Bai acupoint is located on the forehead, identified by measuring about 1 kan above the center of the eyebrow and belongs to the gallbladder meridian. Press the Yang Bai acupoint by using your index finger or thumb to press perpendicularly. The Yang Bai acupoint is effective for treating eye pain, eye diseases, improving vision, treating facial paralysis, headaches, and forehead pain. It also dispels wind, clears heat, and promotes the flow of QI. Second is the Yu Yao acupoint. The Yu Yao acupoint is the depression in the middle of the eyebrow, directly above the pupil. Yu Yao is an extraordinary acupoint. Press the Yu Yao acupoint by using your index finger or thumb to press perpendicularly. The Yu Yao acupoint is effective for treating myopia, conjunctivitis, facial paralysis, orbital neuralgia, and pterygium. Third is the Zanju acupoint. Zanju is located at the depression at the inner end of the eyebrow along the bladder meridian. It is effective for treating headaches, eye fatigue, improving vision, and facial paralysis. When pressing the Zanju point, use your thumb or index finger to apply pressure in the direction toward the top of the head. Fourth is the Jingming acupoint. The Jingming point is located in the depression just in front of the inner corner of the eye. Jingming belongs to the bladder meridian and is effective for brightening the pupils and treating eye diseases. When pressing the Jingming point, use your index finger or thumb, directing the force toward each other to form a V shape. Fifth is the Sijukong acupoint. The Sijukong point is the depression at the end of the eyebrow and belongs to the triple burner meridian. When pressing the earlobe, do not use your index finger or thumb to press in the direction of force towards the opposite ear. Bamboo has the effect of treating headaches, eye diseases, dispersing wind, relieving pain, clearing fire, reducing heat, and regulating the flow of qi in the triple burner. Sixth is the Chenki acupoint. The Chenki point is located in the depression between the lower edge of the eye socket, directly below the pupil, and belongs to the stomach meridian. When pressing, use your index finger or thumb to place on the acupoint, directing the pressure downward toward the feet. The Chenki acupoint is effective in treating tearing when exposed to wind, controlling watery eyes and dacryocystitis, treating conjunctivitis, myopia, hyperopia, optic neuritis, optic nerve atrophy, dispelling wind and clearing heat, and relieving facial neuralgia. Seventh is the Sibai acupoint. The Sibai acupoint is a depression located directly below the Chenki point, about 1 kan down, along the stomach meridian. When pressing, use your index finger to press perpendicularly. The Sibai acupoint helps brighten the eyes, treats facial paralysis, facial neuralgia, headaches, dispels wind, and clears heat. Eighth is the Yingxiang acupoint. The Yingxiang point is located at the intersection of the horizontal line of the nostril and the nasolabial groove. The Yingxiang acupoint belongs to the large intestine meridian and is effective in treating nasal conditions and clearing nasal passages. When pressing the Yingxiang point, use your index finger to massage and press the spot, angling the pressure slightly toward the cheekbone. Ninth is the Quan Liao acupoint. The Quan Liao point is the large depression beside the cheekbone, located at the intersection of the line from the outer corner of the eye and the horizontal line from the nostril, and it belongs to the small intestine meridian. When pressing the Quan Liao point, use your thumb to press into the acupoint and hook upward, directing the force toward the eye. The Quan Liao point is effective for treating facial paralysis, facial muscle spasms, toothache, and trigeminal neuralgia. 10th is the Di Kang acupoint. The Di Kang point is located near the mouth, about 0.4 kan from the corner of the mouth, identified at the intersection of the nasolabial groove and the horizontal line from the corner of the mouth, and it belongs to the stomach meridian. When pressing the Di Kang point, use your index or middle fingers to press both sides simultaneously, applying force in a V shape. The Di Kang point is effective for treating facial paralysis, trigeminal and facial nerve pain, drooling, dispelling wind pathogens, and relieving QI stagnation. 11 is the Jiache point. The Jiache point is located on both cheeks, above and in front of the angle of the lower jawbone. To locate it, clench your teeth tightly. The spot where the muscle bulges is the position of the point. Use your index finger, thumb, or middle finger to press and massage the point, directing the pressure inward toward the jaw. The Jiache point belongs to the stomach meridian and is effective for treating toothache, jaw joint pain, otitis media, facial paralysis, poor digestion, bloating, and belching. 12 is the Renjong point. The Renjong point is located on the upper third of the philtrum groove and belongs to the due meridian. The Ren Jong point is effective for treating mouth distortion, upper lip twitching, calming the mind, dispelling wind pathogens, benefiting the back and spine, rapidly clearing heat, and regulating rebellious QI. When pressing, we use the index finger or thumb to press perpendicularly. 13 is the Yifang point. Yifang is the depression located right behind the earlobe. Press the earlobe down. Wherever it touches is the location of the point. The Yifang point belongs to the Sanjiao meridian and is effective for treating tinnitus, deafness, and hearing loss. When pressing Yifang, use the index finger to gently press on the point, directing the pressure toward the angle of the jaw. 14 is the Tinghui point. The Tinghui point is the depression in the groove in front of the ear flap, located just below the Tinggong point, and belongs to the gallbladder meridian. When pressing Tinghui, use your index or middle finger to place on the point, pressing inward toward the ear. Tinghui is effective for treating tinnitus, deafness, otitis media, facial paralysis, and temporomandibular joint inflammation. 15 is the Tinggong point. The Tinggong point is the depression located right in the middle of the groove in front of the ear flap and belongs to the small intestine meridian. When pressing, use your index or middle finger, open your mouth, place your finger on the point, and press inward toward the ear. The Tinggong point is effective for treating tinnitus, deafness, otitis media, otitis externa, calming the mind, and treating facial paralysis. 16 is the Ermen point. The Ermen point is the depression in front of the ear, just above the Tinggong point, and belongs to the triple burner meridian. When pressing, use your index or middle finger to place on the acupoint, pressing inward toward the ear. The Ermen point is effective for treating tinnitus, deafness, otitis media, dispelling pathogenic heat, unblocking qi, and treating facial paralysis. 17 is the Shuaigu point. The Shuaigu point is a depression located by measuring straight up from the top of the ear, about 1.5 kan, which is approximately the width of 2 of the patient's fingers. When pressing the Shuaigu point, use your index finger, middle finger, or thumb to massage and press perpendicularly at the spot. The Shuaigu point belongs to the gallbladder meridian and is effective in treating headaches, migraines, dizziness, blurred vision, and facial neuralgia. For each acupoint, we should press slowly, massage, and hold for 10 seconds, then slowly release and repeat 10 times. Practice this regularly every day.